recording, right? Yep. Awesome. I've had a stressful day. It's a lot of caffeine today. All right, ready?
Ready.
Welcome to Mindset and Muscles with Amanda. I'm your host, Amanda Ferlisi. Let's welcome back Garrett for our physical therapy series. So, Garrett, I have a lot of hot button topics to go over today. So, pretty relatable to everybody, anyone that owns a business or basically just works in life. So, I wanted to start off with this really important question. What did you do during the pandemic when businesses closed?
It's a interesting question. Good question given the space of fitness and of rehabilitation. My experience was a little different. I saw both sides of things because I actually ended up changing jobs this last September, which is now how Amanda and I got linked up again and how I ended up on this podcast, which is great. But when the pandemic hit, I was in a traditional physical therapy setting, outpatient. And there was a lot of challenges retaining patients in that time. So I saw patients virtually. I wouldn't say a good majority of my caseload came over, just by nature of a number of things. The model itself was challenging. I was seeing a lot of people on a daily basis, and I think that the established rapport wasn't always there, at least enough to get over the barrier of connecting during the pandemic when everyone was kind of stressed out and frazzled. And I think for a lot of people, finding time to exercise or address some of their health and wellness issues kind of came secondary to obviously health and safety and security that everyone was searching for. So I can't say in the moment of the pandemic, I was able to successfully maintain my caseload. However, it was one of those moments where I think if I could go back and do things differently, there were a number of things that I would have liked to do. One was proactively build a platform for virtual visits and virtual sessions. It's a tough sell to kind of make that change on the fly when everyone has grown accustomed to being in person and everyone was used to coming into the office and coming into our clinic. As we said in the first podcast, my location was in a gym in the Prudential Center. So it was very easy for those people at work to come see me. And I think that being the norm, it was a tough discussion to have via email, and an even tougher discussion to have getting somebody on the schedule. And part of that I think would have been mitigated if we had built in some of those tools initially. So I think hopefully there's no more pandemics. Hopefully there's no more shutdowns, but I think prepping for that here, we have been trying to build those systems proactively so that if something were to happen, we would be able to continue plugging and continue seeing people kind of without skipping a beat as much as possible.
Yeah, I mean, I agree with you 100%. I don't think anyone in life was really prepared to deal with this at all. I mean, you and I both work with people. We're very hands-on people. Like you have to be with that person. I mean, it'd be different if I were like, hey, Garrett, let's set up a virtual thing, because I almost did once. Because you know me, you know my body and everything like that. So having a virtual session with you at that point would have been, pretty simple. But just given like the whole let's shut everything down, go to virtual, people shied away from it. I mean, especially for fitness, people were like, I'm not going to do something virtual. Like, that's just weird to me. And I think in general, people's health took they put it on the back burner, especially like their health, mobility, recovery, all those things. So, I mean, I think this whole pandemic did a lot of good, didn't do anything good. I mean, brought out how to roll with the punches more and work with people virtually. But honestly, I don't think anyone was really prepared to just shift their whole, especially fitness, physical therapy, anything that with people that work in person.
I think it really stretched or tested the clinician and coach's ability to be creative. especially coming from a place where there was, as many resources that you could ask for in terms of fitness equipment and availability of weights, and the type of different things that you can do in those type of settings was all available to something where somebody might not have had a good
Right.
setup. They might have a band, they might have a dumbbell if they got on Amazon before everything was shorted. So I
Now
think,
that's a story in itself, trying to get equipment.
I know we're running into that now. We're pretty much up and running, but there's the last piece of equipment that we're waiting on that's supposed to be like 6 months from now. So
Well, you should have told me. I have a gym equipment plug, so we'll
uh,
connect after this. No, seriously. So during this whole, debacle, if you will, a company, like a small business in Newton, reached out to me, and I partnered with them. So anyone that wants to purchase fitness equipment gets actually a discount through not using a code, because you have to like talk to them in person.
yeah,
But if you do need anything, let me know. They do home gyms, they do commercial gyms. I'm
okay.
sure they can do physical therapy. So I do
Uh-huh.
have that.
That
I
sounds
do have
great.
that plug. Yeah, too bad when everything happened. I felt like it was like Al Capone. We were like trying to get equipment from people, and like honestly, I had some like two guys deliver weights from 20 pounds to 100 pounds, and they had to like go down a hill and like literally farmer walk them all the way into my shit.
Sure, they loved
But
you.
they actually are very lovely. They're very nice. So, I mean, hey, but anyway, back to the equipment thing. Just let me know about that. But I just, you're right. I don't think we didn't have the resources to do
Yeah.
and be prepared for things like this. Like, how many of your clients were like, yeah, I have a treadmill at home, I have a band? Like, honestly, like, probably not many.
No, definitely. So it tested the creativity of the coach and the clinician.
Mhm.
Um, and I think the other thing that people can focus on is kind of building up their technology. So
Mhm.
the place I'm at now it's a smaller shop. There's four of us now. We just hired somebody new, so we kind of filled out our team.
Mhm.
Um, but we're all, everyone's on social media. Everyone's trying to build up their kind of educational content. We have a mentorship program that we're offering for other clinicians. So there are other avenues, I
Right.
think, that if again those systems had kind of been developed ahead of time, those can
Mhm.
easily be something that you put your energy into, to try and keep the business going through these kind of crazy unprecedented times.
Right.
So
I did
yeah.
have a question. So I know, so obviously you and I met in the Back Bay. So we just
Mhm.
were flooded with people. Like there was just like a revolving door, like people, client, patient, whatever. Now, my question is, so when you worked there, you left to go work at this place. Was
Mhm.
the pandemic the reason, or was there like,
Um, I mean, the pandemic was part of it.
Mhm.
So my wife and I moved out to the suburbs,
Mhm.
and when the pandemic hit, I was still taking the train in every day, and it was just the way things were looking. It wasn't super comfortable. I
Yeah,
mean, the T has its drawbacks, and aside from trying to get in for a 6:40 patient and there being delays, and
right.
then getting on the rush hour train ride home and kind of all of that, I was looking for a change. So I actually moved locations, and I ended up working out in this direction for maybe 6 months.
Mhm.
And after 6 months, this opportunity opened up, and I'd say the real move was just, this is where I wanted to end up, this
Right.
type of model.
Mhm.
Um, there's a big emphasis on the strength and conditioning side of things through a physical therapist lens, which I've always found interesting. Um, Optimizing performance, a lot of, it sounds like buzzwords, but really it kind of is a changed perspective in terms of how I get to look at a client. And
Like more
to me,
freedom to do what you want to do and
yeah,
like
yeah.
what
I
you
mean,
enjoy.
so more freedom and more room for creativity in terms of treatment. Um, Part of that is just that we're out of network clinicians,
Mhm.
so I'm not I'm not thinking about the units that I'm putting out. I'm not thinking about what reimbursement is coming. So what I'll do is, I provide an invoice for my clients who can then submit for out of network reimbursement based on their insurance plan. But
Mhm.
as far as my care, it is very much just one-on-one. The client's in here, we're treating what the client is complaining about, we're connecting treatment to the client's goals, and I get to see him for a full hour. And with the setup that we have, we can take somebody from very much in acute pain and unable to do the things they want to do, to then transitioning them beyond what they initially wanted to do and kind of getting better at those things from their baseline. So I think for personally, it was more of a professional decision, just in
Right.
terms of what my interests were and kind of all the courses that I'd taken leading up to this. And it was, I kind of lucked out.
Yeah, I mean, it sounds like it checks off all the boxes, like, because you
Mhm.
love physical therapy. So that wasn't the issue. It's just finding the right environment with the right setup that suits what you like to, how you like to treat people and things like that. And more of a small, it seems like more of like a, from the Instagram, it looks pretty cool. It looks like you have like a huge gym setup, right? And
Yeah,
then,
I mean,
yeah,
again, talk about lucking out. I mean, we're in about 2,800 square feet, which isn't huge, but probably the front half of the building has double height ceilings. So we
perfect.
were able to get a rack in. We have a pretty sweet setup with our squat rack, our bench press, um, the full spectrum of dumbbells, in addition to private treatment rooms and stuff. So again, like you said, I really do enjoy physical therapy and seeing people
Mhm.
that come in pain and addressing what is going on and reducing that pain and improving function and everything. But it really allows for treatment along the full continuum of human activity.
Right.
Um, because a lot of clients, you know, they have a baseline of running, or they have a baseline of lifting, or they have a baseline of weekend softball. And depending on what lens you're looking at, it is sometimes challenging to treat people up into the point where they're able to do all of that effectively because you
Right.
have these other constraints. Um, so this model lets us kind of just treat what we see, treat what we want, and
Mhm.
what the client wants. So
I mean, it sounds amazing.
yeah, I'm really enjoying it.
This is the happiest I've ever seen you. I mean, you were always happy and you know what I mean? But like you, like I can feel, you know what I mean? When you could pick up
Yeah.
someone's energy, it just seems great. I have another hot button
Okay.
topic, question, issue, whatever. Um, did you ever reconsider your profession when the world shut down? So once this pandemic hit, did you ever reconsider your entire profession?
I mean, not, I would say not truly.
Okay.
I think there were times when I was, you know, because I ended up having a 4-month vacation that wasn't planned.
Hey,
Um,
spend time
so it
with
was
the
one of
wife.
those things
That's
where I was definitely say I was jealous of the people that didn't have to juggle that
Mhm.
instability, and kind of at times wish there was a little bit more stability in this specific stressor, and would have been able to kind of pick up from working from home and
Mhm.
had one less thing to worry about for sure. I would say um, no, it didn't make me question the entire profession. If anything, it made me kind of more focused on what I really did want to do.
Right.
Um, you know, I bought a bunch of the clinical books that I had been
Mhm.
pushing off, and got to dive into some of the nerdy topics that I didn't really have time to do while I was, you know, seeing a bunch of patients every day. So there was some definite benefits to it. Some definite I definitely had the chance to reset.
Mhm.
Um, so yeah, outside of that, just wishing for some stability. No, I think I still very much enjoy the profession. I enjoy the science behind it. I enjoy, especially now with the longer sessions, being able to talk to people, and you know, you end up kind of being a pseudo bartender to a certain point. You
Oh
hear,
my God. Yeah.
you know,
Oh
you
yeah.
hear
No, we
about all the extra stressors that are going in, and
all the things.
yeah, and I mean, clinically, that all plays a role on physical health and physical
Hmm.
movement. So it's all valuable, but like
Actually,
that's
can you touch on that? Because I think you were the very, yes, you were the first person to tell me, you were like, well, like what happened? Like what stress? And I was just like, what do you mean? You were the first physical therapist to tell me that like your mental stress can, I guess, like resonate in your body.
yeah.
Can you talk about that real quick? Because this is a huge issue with most people.
Yeah, I mean, I think it depends on how deep down the rabbit hole you want to dive, but
Mhm.
um there are physiological changes to stress, from chemistry in your blood to the way you breathe to the way the nervous system fires. And being in a stressful state is going to rev those internal engines to a higher degree, which is fine. The system needs to come up and needs to come down. The problem is when somebody is constantly revving at a high level at a baseline, what is supposed to be a resting state, when they do something that should employ that extra energy or that extra juice, they don't have the capacity to do that. It's almost like redlining a car and not downshifting. So if you're redlining in second gear on the freeway and then suddenly you need to speed up further, the engine's gonna eventually have problems.
Right.
So I think that's probably the simplest way I can describe it, is like someone's resting stress level, or the ability or inability to achieve a restful state, is going to impact movement on a number of different levels. And then you can get into kind of not secondary, but like the other layers of this, where you have people that have a stressful baseline, they have a sedentary job. So for say 22 hours of the day, they're not moving very much. And then they go into the gym and try and train the same way they did when they were 18. And it's like between being stressed, between being not moving regularly, and then going in and training and possibly not the smartest way, like
Right.
that's just a recipe for injury. So stress plays a huge role. Sleep plays a huge role. I mean, both of those things have been talked about in like the performance circles for years, in terms of really emphasizing not just sleep, but quality of sleep. Meditation, breathing, like all of that stuff plays a role in someone's ability to move the way they want to move.
I remember I will never forget the time. I don't know if it was like one of our first sessions. You're like, okay, this is what's gonna happen, and I'm nervous because like I don't trust people. I trust you obviously, but like I was like, who is this guy? You told me to lay flat on my back and like blow into a balloon. You threw me all. I couldn't do it. Can you explain that real quick? Because you used to always tell me like I always flared my ribs, which I'm better at now. And I think I was breathing from my throat and like pretty much wound up 99.99% of the time. So can you explain like why you had me breathe into that and like that whole situation?
Yeah. So I think, so breathing is an active process, right? When you inhale, the diaphragm descends. When you exhale, the diaphragm ascends, and air is exchanged, gases are exchanged, air comes in and out of the system. The way our body is designed, we are designed to breathe with certain muscles and move in a certain way. And as life changes and as those things are not necessarily maintained, the breathing becomes a little off. And if the breathing becomes off, the position of certain structures become off. And then when you're breathing thousands and thousands and thousands of times a day, that's a lot of repetitions in an inefficient state, which can just throw off the ability to go from a resting state to activity and then back again, which was what we discussed with you. The action of breathing into a balloon is really about emphasizing the diaphragm acting the way it is designed to act, and using your obliques to move the rib cage into a position that allows the diaphragm to act the way it is designed to act, to get the most amount of air in throughout the thoracic cavity, and then to expel that air without completely flying out of whack. Because by breathing into a balloon and maintaining that pressure, you have to maintain the intra-abdominal pressure. So it's a challenging exercise for
No,
sure.
like I failed it. I've never failed something so badly in my life.
I mean, it's hard. And I think people, I mean, your reaction is pretty similar whenever me or any of the other clinicians here have somebody do that. It's kind of like, what the hell are we doing? And then the balloon flies out of their mouth on the first attempt. And then you kind of go into the education part of it and help people understand what the reason is behind it and what the benefits are of it. But breath work plays a huge role in a lot of treatment and a lot of performance. And, you know, there's there's science to back up why breath is important. There's a whole lot of philosophies in the PT and performance world that will argue forever about
Mhm.
how and where breath should be influenced, but I think a lot of people can agree that it is important, and can justifiably be a part of both a rehab and a strength and conditioning program.
Can you explain the importance of, so I have a lot of clients that don't like to breathe when they exercise. Can you explain, like, I'll just give one exercise of how someone should breathe throughout this exercise. Does that work?
Yeah.
So if someone is doing a barbell squat, how should they breathe? When should they inhale? When should they exhale?
I would say by and large, the rule of thumb is the very general rule is to exhale on the lift.
Mhm.
So you'd be exhaling as you're returning to a standing position.
Right. And
Um,
can you
Go ahead.
explain, like, a lot of people, so always try to tell people, like, engage your core, which is probably one of the most difficult things to teach someone, and you're really good at that. So can you explain, like, how to keep your core engaged? I don't know if you can actually like explain some words, but keeping your core engaged while also breathing.
Yeah, so I mean that kind of goes into, so if I'm training somebody for a squat, the first thing that I train or check is to make sure that they can maintain some stability through their rib cage and their pelvis while they breathe. Because in a squat, like in a squat, your pelvis needs to stay relatively vertical as your legs come down.
Mm-hmm.
So in order to do that, you need to maintain position of the rib cage. You need your hamstrings to be engaged underneath
Mm-hmm.
to keep your pelvis coming this way. And you need your abs being engaged on the front to keep the rib cage down.
Right.
It's just physics. It's just the opposite, the opposing forces maintaining this position.
Mm-hmm.
So for a squat, very generally and very simplistically, if you can't maintain that rigidity, the easiest thing for you to do to maintain the rigidity is to throw the chest back and dump the pelvis forward, which is where people will run into, they won't be able to get deep because the front of their hips will impinge.
Yep.
They'll feel that tension in the low back, or they'll exacerbate some existing low back pain, or you'll even see the butt wink, right?
Yes.
Everyone has seen the butt wink where someone gets down into a squat and there's a real sharp drop of their pelvis, which is very
Yes.
uncontrolled, which is a loss of control in the lumbar spine. And it's a compensation to try and get into the full depth of the squat.
Mm-hmm.
So when it comes to breathing, breathing is very valuable because if done appropriately, it can influence the activation of the obliques, which controls the ribs. And if you can control the ribs and you can control that opposition, you're going to create a more efficient position for the glutes and the hamstrings to keep that pelvis underneath you.
Mm-hmm.
Does that make sense so far?
I understand everything you say.
Okay.
Because we've talked about this like till so many levels. Because my squat, you took from being to like really good now. Like I don't, honest knock on wood, have not had an issue since you've corrected my squat. So I
Yeah.
know a lot of that had to do with my pelvic tilt that I had and making sure that I wasn't flaring my ribs and keeping my core engaged throughout the motion, which that I try to help with all my clients because a lot of them at the bottom will disengage their core and they just put all their pressure on their back. So I think
Yeah.
this is a really important topic because I see it all the time. I see it whether it's a client or I'm just working out in the gym or on Instagram, which has like some terrible things on there, which I know you're new to Instagram, so I'm sure you've
I'm
seen
new.
all.
I'm new.
um,
Learning.
I do have, let's see. So how were you able to build your clientele? So I think this, all these questions are relatable to both of us. Um, so you just started not too long ago. So what techniques, tools have you done to gain some clients, patients?
Um, I think the first part is almost more introspective, um, and is more figuring out who your ideal client is, figuring out what that profile looks like. Because in the change of models, it went from casting a wide net to try and get everybody to really kind of refining the treatment and knowing that specific subsets of the patient population are going to benefit more from that than others.
Mm-hmm.
And once that's identified, then it's identifying where those types of individuals are. So for us, it's a lot of the boutique fitness studios. It's a lot of the trainers in the area. A lot of people that have developed relationships with their clients and are looking for trustworthy clinicians to refer with, and then vice versa, right? Because from a business sense, like, I don't want to steal the trainer's clients. What I would actually almost say is that by sending them to us, they will come back and work out better with you. You'll be able to get better results, and then
Right.
you'll have more buy-in and better retention.
Which is
Give me
what we
one
did
second.
down in, yeah.
I'm gonna turn the light on 1 second.
Yeah. I mean, that was one of the main reasons why we developed such a good working relationship, because I would have clients that, I can only help to a certain point, and you just took them and helped them move better, function better. I mean, exactly what you're saying. It's almost why I always tell my clients, like, you should go see a physical therapist. I mean, too bad we're not close enough for me to refer to clients all the way where you are just yet. Soon, you never know. But yeah, I mean, having a good relationship with a trainer and a physical therapist, I can't preach that enough. So I think it's great what you guys are doing, and just reaching out to people that are trainers in the area to link up with their clients, because everyone has some type of issue, right?
Yeah.
So I think that's great.
Yeah, we've also had some some decent success. We're developing a program working with a dentist in our building. The one of the philosophies that we follow is about pattern movement, and that pattern will find its way up into the jaw and the neck. So with dentists that get a lot of TMJ diagnoses, I've had a lot of success treating those diagnoses without doing the fish hook manual or kind of hammering the jaw.
I felt that.
And just trying to correct some of the imbalances that are present in everybody. So one of the dentists in our building is very interested in what we have going on. She's actually going to come down, and we're going to take a course all together, which is awesome. So
I
it's
mean,
a lot
that's
of
great. Like,
yeah.
I
It's
would have
fantastic.
never thought, honestly, when you were like dentist in my head, I'm like, I mean, okay. But when you say that, because so many people, I mean, including myself, because shocking, clench their jaw, develop issues within their neck, up into their head, down into the shoulder, the whole thing, because it's all related, which you also taught me, like, one issue is related up and down the body. So that's a great idea.
Yeah.
So
So I
any
mean, we're
physical
pretty
therapists
excited.
out there.
I mean, we're pretty excited. It doesn't happen all that often, just
Right.
because in any profession there's a wide spectrum of thought processes and ideas and philosophies, and those things don't always match up. But we've kind of lucked into it where one of the dentists upstairs is very interested. And I mean, the fact that she wants to come down and take a course with us is, I mean, I'm still surprised, but stoked for sure.
That's awesome. I think that's honestly, like, great idea. All right, so into some more questions. This is a good one. This is actually someone that we both had as a client. Um, how do you turn up workout intensity when coming back from a chronic injury? This is very relatable for a lot of people.
I mean, it's a good question, and it's one of those that the people end up kind of feeling left out to dry on, because it's hard to get. First off, it's hard to get a good program. I mean, I could say just myself, like, I don't write good programs for myself at all.
But you can help people. Yeah.
Yeah. So like, I don't. There's a disconnect when you're trying to do things solo for yourself. I mean, my personal opinion when it comes to coming back from a chronic injury is starting with the big movement patterns. So starting with a squat, starting with a hinge, starting with a press, and then kind of building out from there. So you're building foundational strength.
Okay.
Again, I don't know where in that spectrum to answer the question.
So hold on, I'll make it a little bit more specific. So because I probably have just now 6 clients that have either torn their ACL or MCL or both, can you explain, and still most of them, are able to do all the exercises, unilateral movements, slight weaknesses, just building back up. And that's normal and expected when you have something like that. So I have one client that is still, and the injury was, I want to say a year and a half ago, she tore her ACL. She's still hesitant to work out to that level of intensity of just say a jumping jack, or if there's a slight maybe pain or like an odd feeling, she gets nervous and is like, I don't want to do that. So can you explain like how that person should, I guess just maybe explain like what you would do with that?
Well, I mean, I think when it comes to ACL rehab, the final hurdle is typically the mental component.
Yes.
Um, very much so to get back to the point where you're not thinking about the knee and get back to the point where you're just acting and reacting without feeling like you have had an injury is
Right.
the hardest factor. And I would say, um, depending on their goals, I typically am having people do very, very low level plyometrics pretty early just to start gaining that process. So something as simple as a false drop, where
Mhm.
you're standing up straight and you act like the ground got dropped out from underneath you and you catch yourself after a couple inches. Um, Something as simple as that gets a little bit of elasticity through the hamstrings. The
Mhm.
glutes have to act. We could talk about the core and all that stuff has to act, but it's also acting as getting weight through that knee,
Mhm.
which for a long time with ACLs, that's not always comfortable. So you're kind of building that confidence back up. Um, and then all the while building up strength again. So squats, deadlifts, um, split squats with a medicine ball, not toss, but a pull through, so that you're getting some absorption into that knee. You could
Mhm.
do Payloft presses in a split squat. There's countless varieties of things that
Right.
you could do. The other thing that I would consider would be some tempo work, so some slow, very controlled movements.
Mhm.
That's going to address the mechanical tension through the tissue and the time spent under load, which are two big factors in improving strength. But it's also going to serve as a very controlled movement, so that sense of the inability to control the injured, quote unquote,
I
injured
understand what you're saying. Yeah.
injured tissue is going to be reduced.
Okay.
Um, does that
I
make
think
sense?
I just honestly, I think it's a lot of mental, and myself included. I don't have any, knock on wood, any injuries like that, but I know my TFL or and certain things get super tight and like, you know, bunched up often. And a lot of it has to do with stress and just the way my body's naturally shaped. And I always tell people like, listen, if you don't feel any pain, like it's like you're not going to do anything right in this moment that's going to cause you harm. I'm not going to have you do anything. So I think a lot of it is just getting up and over that and trusting their body. And I have like one, now that I think about it, two clients that just still get a little nervous and they're doing like, you know, compound movements, but nothing too crazy. So they still have that issue. And it's just, it's tough to, you can't tell someone like, get
Yeah.
over it. Like I would never do that. But like trying to like trust their own body, it's very tough for them.
Well, I think another thing to consider is to simplify things for the client.
Hmm.
So if I'm making a program and someone's feeling kind of funky on it, and I know in their stage of healing they're structurally sound, I might treat it almost as just a strength program
Hmm.
where my measurement is going to be the volume of the weight lifted throughout that session. And then they're going to see as they progress increasing volumes based on how much weight they're moving rather than changing up the exercises every time.
Hmm.
Because I think at times that is where definitely physical therapists can run into an issue, is that everything has to be new every time.
Hmm.
That's not necessarily the case. Like you
It's
you
not.
can you can refine, and you can, if you're trying to change strength, like you can do the same exercise, but if you're changing the weight, it is a successful session.
Right.
um so I think trying to simplify things as much as possible is always beneficial as well.
Yeah. And I mean, one of the main things that, like, if my client's like, oh, I feel a little weird, it's like, I, I encourage them to push through that because a lot of it, I believe is mental. So I just have them push through it because you and I both know that there's no, you don't need to do 1,000 different exercises to achieve a goal. It's pretty basic. You just add resistance and tension over time, right? So I think you nailed that with that. This is my favorite one because I hate my TFL. But what is TFL referred pain, and what issues can a tight TFL cause?
Huh. So I'm not totally sure what they mean by the referred pain.
I guess talk about what can a tight TFL cause?
Yeah.
Yeah, I would go with that.
So can I share my screen?
I mean, I hope so. Just don't end the call. We already
Okay.
had an
No.
issue.
Let me share it real quick.
Do you guys do any dry needling over there? Or is that not part of the?
We don't.
Hmm.
I think that might be on
Is it
the
on the agenda?
to-do. Yeah, it's on the agenda, but we haven't done it yet. Huh.
If you can't share the screen, what you can do is send me something that I can add into the podcast and add it into the video so people
Okay.
can see it. I can figure something out, I'm sure. They have do not disturb for a reason.
Yeah, rookie move. I know. Oh, we're good. Can I send you the picture after the podcast?
Yeah, send me the picture, and
Okay.
I just want you to explain what issues a tight TFL can
Yeah.
cause.
Well, part of explaining where a tight TFL can cause issues is looking at the attachments of the TFL.
Mhm.
So let me pull out the pelvis, and we will talk through that. All right. So the TFL is a relatively small muscle, and it's on the side of the hip. It attaches right along the edge of the iliac crest up here, and then will taper down to that IT band that runs all the way down to the knee.
Mhm.
The muscle belly sits kind of in front of the axis of rotation of that hip joint.
Okay.
So I'll send you that image, but there's a good image that will be able to explain that well. But a tight TFL is going to indicate a number of things, or cause a number of things. A tight TFL can cause that IT band syndrome that is very commonly diagnosed, and has led to a lot of foam rolling of the IT band, which doesn't have a lot of research to support it. The IT band is a non-contractile tissue. So when people are feeling stiffness or trigger points through their IT band, they're typically feeling the lateral quad or the lateral hamstring that is tight.
Mhm.
And rolling those things will increase blood flow short term. It'll increase the tissue temperature short term, but it's not going to solve the problem. So you kind of have to look further up the chain, which is similar to what we were talking about last time.
Mhm.
But if a TFL is tight, that is typically going to indicate that the glutes aren't able to fire. So if this muscle is overactive, it is likely due to inactivity through the glutes back here. That is typically seen through this type of position,
Pelvic tilt,
the pelvic tilt.
the best.
So if someone is tilted forward, but also unable to correct that position,
Mhm.
that TFL will end up being overactive and will actually be asked to do the job of a lot of these bigger, stronger muscles.
Mhm.
That chronic overload or that repetitive use is going to result in tightness and kind of the sensation that it's never shutting off. So if somebody comes in to me with a TFL strain or IT band issues, I typically work to get into a posterior tilt or out of an anterior tilt.
Mhm.
And then once that position is able to be achieved and maintained, then it's strengthening into that squat movement, into the hinge movement, into all these big movements that people are typically trying to do with a tight IT band, but they're just using a smaller, less efficient muscle to do the job. But a tight TFL, that can present as a tendonitis at the hip. It can present as tightness in the IT band in the middle of the leg. It could present as tightness in the lateral knee. Um, I've seen it where it's been so quote unquote tight that the patella has been tracking poorly, which is the kneecap. There is a surgical procedure that is actually designed to release the tension, that anecdotally, I don't know the evidence on this, but I haven't seen be more than 50% effective, just because those movement patterns haven't been changed. So if you go in and change the structure but don't change the drivers behind it,
Right.
it's
Still
going
gonna
to
have the
still
issue.
kind of crop up. So
Mhm.
I would say at a baseline, when I treat TFL, it's really getting after the hamstrings, getting after the glutes, and getting after the obliques, in a number of different ways and a number of different positions to try and create balance around the pelvis.
I mean, I can relate because my TFL is terrible. I get it. It actually has been very good. And I recently had to get it dry needled. Now, this was odd. Um, I had like the tight TFL. He needled it like ridiculous amount. And I felt like a release that went from my TFL. So it's my left leg, obviously. So it went from my TFL across my quad, like so my knees here, like it went like this, and then into I don't know what it's called. So like my shin almost. And it just stopped. It was like, now that was crazy. So you're saying that the TFL can cause all of that all the way down, essentially, could it to your ankle?
Yeah, I mean, yeah, I think if we're looking at the TFL not as an isolated structure, so
Mm-hmm.
if we're looking at the TFL as or TFL tightness as a byproduct of a position or
Mm-hmm.
inefficient movement, then yeah, those symptoms can absolutely get down to the ankle. And if I'm understanding what your symptoms were, there's another muscle that starts off where the TFL does and actually crosses the knee, crosses the leg down toward the medial side of the knee.
Mm-hmm.
You might have had some tension there as well, which could explain that
Which
kind of
muscle is that?
reaction. The sartorius.
Probably. I mean, he put a lot of needles in me, and
Yeah.
like, because again, like we talked about earlier in this podcast, a lot of like stress. So if you have like one small issue and it just can get exacerbated by the stress of like life, whatever. And I think that's exactly what happened. It just kind of like festered and just got worse and worse and worse. And then I had to treat it that way because for me
Yeah.
and my body, it doesn't like to release
Yeah.
that. Can you explain that actually? Like why it's tough for certain people to release tension?
Um, I
I know we
mean,
talked about stress, but like maybe a little bit more.
I can I can talk theoretically and anecdotally. I
Okay.
can't say that I can cite research articles on it, but just based on what the clients that I've seen,
Hmm.
um, there are there are people that have built up stress because life has gotten stressful. You know,
Hmm.
a job is a demanding job, family has its own demands, their own personal life has its own demands, and then over time that tension can build. There are also people who at a baseline are just more stressed than others. And from my experience, the people that kind of carry more stress at a baseline are the ones that have a tougher time letting go.
Hmm.
Part of that is it's not easy. Like we're talking about this, like letting go is super easy.
I mean,
The
you can use me as an example. I can't let anything go in my body. And like we had
Yeah.
a lot of
So,
issues with that.
and I think that part of that is going to be on the responsibility of the physical therapist or the coach, where I don't necessarily think it would do you good if you came into the clinic and I just absolutely released everything. I think I mean, that might feel good lying on the
No, I
table,
know.
but then
Yes.
when you got up and moved around, it would almost be disconcerting, which would then increase the stress and we'd be back in the same position. So I think some people have a tougher time letting go because while stress can be a limiting factor, it's also so ingrained in their perception
Hmm.
that the absence of it can also cause a problem. Um, I mean, similar to when, you know, if you have back pain and your low back is super tight,
Right.
it's tight for a reason. And
Hmm.
part of it is because it's trying to prevent pain.
Hmm.
And if somebody comes in and I only release the back and I don't do anything else, they're going to walk out probably in more pain because the one technique they were using to prevent pain is now gone.
Hmm.
So if I'm going to provide a release or reduce some tension in someone's muscles, I have to provide uh, an opposite action to replace the action of that inefficient tissue. And I think that is the challenge of the clinician, but it can't be minimized that some people just by nature of them have a hard time letting go of that. I mean, you'd be a prime example. I think that the absence of that tension would probably be to a certain extent stress inducing. Or the, like the idea of letting go is just not necessarily something that comes naturally.
Honestly, like I literally never knew that until I met you and you told me. I'm like, no, because like I just think I just coast, but I don't. And it's so interesting you bring this up because a lot of people, especially, I mean, my issues like my whole left side, but I have a lot of clients and just people I've met with throughout the years that have such bad issues in their neck, and because they're like this posture, stress of the job, like they just like cannot relax. So I think learning good relaxation techniques, honestly, like we could probably go back and forth about like how to calm down, but like there's no like exact answer for each person, I think. So I mean,
No, I agree. And I would say that just as I've treated more and kind of seen more and more clients, I would say that I have almost gotten away from some of the real pure relaxation techniques
mhm,
and just gotten more so into the idea of like, this person's not moving well, they're not positioned well. How can I expose them to movements that they don't typically do
mhm,
without exacerbating their pain?
mhm,
So, like a perfect example is the assault bike or the echo bike. For someone that's very stiff or that have neck pain, I'll put them on the assault bike, have them go at a low level intensity, but I don't let their head move.
mhm.
So if they're moving their arms, they're getting some cervical rotation
Right.
just by nature of how those shoulders have to move, but it's not reaching a level that is causing pain, and it's not reaching a level of consciousness that's stress inducing. And
Mhm,
you're actually going to get some of that inhibitory effect, but you're doing it actively, which I think is always good.
mhm.
It gives the client or the patient more control over their discomfort, and that at the end of the day, that's kind of what, as a clinician, we should want.
Mhm.
We should want the client to be able to do things and control things by themselves and come back to us for progress,
Right.
get better. Um,
I mean, the
so
goal
that's
is you don't want to have me as a patient forever. The goal is to do like, apply everything that you teach, work with someone, physical therapist, personal trainer, get better over time, and then have like some check-ins here and there. And honestly, like I can't be a stronger advocate for physical therapy, and myself being a trainer working with a physical therapist, whether it's for me or for my clients, like honestly. And then as far as the relaxation, I think you make a good point. I think we could honestly have like a whole podcast on like relaxation, because like it's funny because like my clients will do something, whether like if they're like a pulling motion and they go like this, they just like instinctively just go up like this, and to have someone not even know that they feel that, like I know I've done it before, but not as crazy as some things that I've seen.
yeah,
So I think relaxation techniques would be definitely something we should talk about.
yeah.
um that's all I have for questions today. I think those are some really good questions. It opened up a lot of other questions. So, Garrett, do you have anything else to add?
No, I think by and large that was a good sample of questions.
Hmm.
I liked being able to get into some of the treatment type stuff. So if anybody else has any more questions, I
Hmm.
obviously can't get too specific just based on
Yeah, because you need to know
medium
the
that we're
person.
working
Yeah.
in. But generally, happy to talk shop. And so any more questions, send them in.
Awesome. All right. Well, we're going to wrap up here. So, thank you all for tuning in. And thank you, Garrett, for continuously supporting my podcast and this nice banter that we have back and forth. So, thank you, everybody, for listening, and have a wonderful holiday.